All right. Hello, everybody. Dr. Rafich here, Vet Triage. Perfect. Thank you. Wonderful. We are in Atlantic City for a conference at the hotel, and we're going to be going through this JAVMA Medical Journal, May 15, 2015. We are going to be talking about a laparoscopic inguinal hernioplasty and a RAM. So, for those who don't know, laparoscopy is the use of instruments that are fit into the body of a patient with tiny incisions. Those those ports, those little incisions, help with placing cameras, surgical instruments in there, and the camera is connected to a TV tower that the surgeon can look at while they're navigating the abdomen, let's say, or chest, and it allows surgeries to be performed in a minimally invasive manner. Not every surgery can be performed this way. Sometimes you have to perform what's called an open surgery in general, but otherwise, for the right patient, for the right surgery, the right condition, laparoscopy is a pretty cool thing to do. So that's what they did for this ram, which is a male sheep. Inguinal hernioplasty. The inguinal is your groin area, and there are vessels, nerves that pass through it, as well as the vas deferens, which is the passageway for sperm. And an inguinal hernia means a groin has a hernia, and a hernia is protrusion of, it's too large of a hole of a natural opening, and there can be protrusion of internal organs through it. Hernioplasty is the surgery term to fix a hernia. So in this case, a 4-month-old Hampshire ram had an open right inguinal herniorrhaphy and unilateral castration after being kicked. Now, the open right inguinal herniorrhaphy, open meaning not laparoscopic, but actual incision, they open the patient up. Right inguinal, so the right groin area, herniorrhaphy, which is repairing the hernia. Unilateral castration, that's interesting. They removed one testicle because it was traumatized from the kick injury and left the other testicle intact. Several months later, the ram was reevaluated for a scrotal swelling, suspected left-sided inguinal hernia. The first side was on the right. So on physical exam, there was scrotal swelling. The left testicle felt normal, and ultrasound showed that there were omentum in the inguinal hernia, as well as some hypoechoic fluid at the scrotal apex. Hypoechoic means that on ultrasound or ultrasonography, the hypoechoic means that it's a darker fluid, and scrotal apex is at the top of the scrotum. Examination findings indicated a left-sided indirect inguinal herniation of the omentum. The patient was anesthetized, placed in dorsal recumbency. They found omental entrapment, so omentum was entrapped in the left inguinal ring. The omentum, for those who don't know, is a lace-like structure that covers the abdominal organs, and it's usually covered in, it's a very thin mesentery, and it has fat usually deposits in it. But the main purpose of omentum is to help transport white blood cells to areas of concern. It helps with lymphatic drainage and lots of other neat things. It's a pretty cool organ. The internal inguinal hernia was repaired using an articulating hernia stapler. They placed mesh over the hernia and then a peritoneal flap over the mesh. Mesh is like this crisscross wire, very soft surgical wire that is like a patch, and that's placed over defects like a hernia. Peritoneal flap, they took a portion of the layer of the abdominal wall, which is the peritoneum, and they elevated that. Usually the peritoneum is covering the abdominal muscles, and they elevated it and put that over the mesh to help with protecting the mesh. The ram healed and was able to breed later on. So that's my first issue with this, is the ethics of it, because most of us believe that having a hernia, if it's not induced by trauma, like the right side was, in this case, the left side seemed to be spontaneous, that there's a genetic component, there's a heritability to it. And in those pets, typically you're not just repairing the hernia, but you're also sterilizing them so that you don't pass on those genes to offspring. So it's interesting that they saved the testicle, the one testicle here, and then had the sheep breed again. But I guess because they can't prove that it wasn't from the original trauma of being kicked, maybe that's why they went with it. I don't know. So let's go into the background of this case. 4-month-old ram presented to Colorado State University, got kicked 1 week before, had a scrotal hematoma. They tried medically managing it with cold hydrotherapy, nonsteroidal anti-inflammatories, antibiotics. 1 month after that, there was a persistent right-sided scrotal swelling, and they repaired it with the open inguinal herniorrhaphy. At 11 months of age, so 7 months later, left-sided scrotal swelling occurred, and it was there for about a month. The left-sided indirect inguinal hernia with omentum herniation was found, and they did discuss the ethics of repair. There you go. Blood work showed mild anemia, which might be chronic inflammation, and a decreased red blood cell production from bone marrow, but it wasn't considered significantly enough to impact the surgery. And the sheep had a mildly high creatine kinase. Creatine kinase is an enzyme that you will measure from blood. It's usually secondary to muscle breakdown, and which of course happens all the time in the body. An excessive amount means usually that there's muscle damage. It could mean other things like kidney issues, but most often it's muscle damage, and so you wonder if that's probably from the hernia. The patient was anesthetized. They used flunixin meglumine. They used tulathromycin, which is an antibiotic. They used diazepam, which is Valium, ketamine, and placed the patient on sevoflurane, so gas anesthesia with oxygen. And then they had a CRI, constant rate infusion of ketamine, as well as lidocaine. They placed the ram in the Trendelenburg position. So for those who don't know, the Trendelenburg position, it's named after somebody, it's why it's a stupid name, is when the patient is on the operating room table and they're tilted where their feet is above their head. And it's about 15 to 30 degrees tilt. And then the reverse of that, where the head is higher than the feet, is called the reverse Trendelenburg. The idea there is to help with laparoscopic evaluation of the organs. If you want things to be seen easier, you have the patient tilted with their feet higher than their head, because that way the diaphragm, as it's moving during respirations, doesn't impact the size of the abdominal cavity, so you can see the abdominal cavity better. It also allows for the organs to shift in that direction in case you're working in the inguinal area, which is what we're going to be doing. So it gets the organs out of the way for your surgery in this case. Then they place their ports for the laparoscopy. They use a carbon dioxide pressure of 10 to 12 millimeters of mercury. The abdominal cavity is insufflated with gas, and we normally use CO2 or carbon dioxide to expand the abdomen, and that expansion compresses the abdominal organs to get them out of your way, but also allows for you to have room to work in the abdomen. They use a 10 millimeter, 30 degree, 33 centimeter rigid laparoscope for the procedure. So in this picture, this is the ram on his back, and the little L1, L2, L3 are the ports where they place the instruments into the ram, and then the L1, the big one, is where the camera went, and then SC down the bottom of the picture is the swollen scrotum. So then they had pictures here of the laparoscopy. It's pretty cool. So you can see there on this picture that there is the internal abdominal oblique muscle, IAO. There is the omentum at the bottom there, OM, and you can see it's herniated through. Then they remove the hernia to reveal on the next picture here the piniform plexus, which is the blood supply to the scrotum, which is VASC in the picture, and you can see the abdominal muscle there. So, all right. Then in this picture here, boom, you can see right there. So this is the mesh placement. You can see it says mesh on there as well. So that's pretty cool. And then on the picture next to it, right there, you can see the peritoneal flap, which is PF. And because so you see the mesh now is covered by peritoneal flap to protect the body wall from the mesh and help support the surgery. And then the internal abdominal muscle, the oblique muscle up here, is now exposed because the peritoneum was removed from it. And then this down here is a fan retractor, that metal thing. That's part of the instruments to help move the omentum out of the way. They did a breeding soundness exam after surgery 5 months later, and the spermatozoa count was normal, that's sperm count, and motility was adequate for the sperm, and the ram was returned to breeding. And that's why I questioned the ethics behind it, which they apparently did discuss with the client. So discussion, indirect inguinal hernia formation in rams, a condition often referred to as a scrotal hernia, accounts for up to 7% of congenital disorders and up to 15% of all hernias in sheep. Congenital means it's present at birth, which usually implies genetics, but not always. It could be traumatic or infectious, but it's present at birth. Causes include genetic trauma and advanced age. Heritability is poorly understood. Congenital scrotal hernias are more rare than those acquired via trauma, and injury during mounting for breeding is most often implicated trauma for causing a scrotal hernia. Surgical correction is a treatment of choice. Usually your options are herniotomy, herniorrhaphy, and unilateral orchiectomy. Herniotomy is to try and enlarge the hernia opening, and herniorrhaphy is intended to close the opening. It just depends on what your goals are. And then unilateral orchiectomy is removing the testicle on that side. Attempts to perform your herniorrhaphy by suturing the inguinal ring without removing the testicle on the affected side can cause narrowing of the ring, and then in rams will result in ischemia of the testes on the affected side. So when you close the inguinal ring that way, it'll lose blood supply, and that's why you remove the testicle. Laparoscopic inguinal hernioplasty without orchiectomy is an option for people who don't want to castrate their sheep or the patient. Other species have been reported to have their inguinal hernias treated with cyanoacrylate glue, polypropylene mesh, intracorporeal sutures, or peritoneal flap. So glue is glue, it's surgical glue. The polypropylene mesh is the same mesh they used here for this ram. Intracorporeal sutures. Intracorporeal means that you're placing the sutures, you're setting up and placing the sutures in the abdominal, in the body cavity of the patient, in this case, the abdominal cavity. So sutures are actually placed inside the belly. And then peritoneal flap, which they also used here. The success rate of those approaches are high with no apparent effect on fertility. Here they combined both mesh and the peritoneal hernioplasty. The mesh results in repair strength superior to tissue reconstruction, which lowers the recurrence rate of the hernia. Peritoneal overlay, so the peritoneal flap, prevents visceral mesh contact, so it prevents the mesh from touching the internal organs, and it provides additional security for the repair. Finally, in humans and horses, you can use what's called hand-assisted laparoscopic surgery, where you can use your hands to apply traction to organs. It's beneficial because using your hands is more trustworthy than feeling through instruments. But you have to have a specialized portal that's required to maintain insufflation of the abdomen in order to do that. So they did not do that here. And then in horses, when they have them in the Trendelenburg positioning for laparoscopy with abdominal insufflation, it causes a decrease in the PaCO2, so the carbon dioxide concentrations in the arterial supply. It decreases the arterial oxygen levels as well. It decreases arterial blood pressure, and it increases mean arterial blood pressure. But those cardiovascular abnormalities were not seen in this case. So that's it. That's a pretty interesting. This is the first ever report of a ram that's had an inguinal herniorrhaphy via laparoscopy. So a pretty cool case. And that's it for today. Thanks so much, folks. For those who watched on playback, thank you. And I will be back tomorrow. Take care. Bye. Bye-bye.